Hello, hello. If everybody could grab a seat. Jeff Belotti, everybody. Hello, sir. Thanks, everybody, for joining us this late morning here in the Truist tent here at Windham Championship at Sedgeville Country Club. You know, when you guys all were having so much fun there, I didn't want to be the guy that stopped all your champagne, mimosa, and Bloody Mary drinking there. So I think they're still serving those for most of the day, so y'all just keep going, because our program gets better and better as the drinks go. And I think no way we're going to run out. So anyway, welcome to the 2022 Windham Championship. If you're not that familiar with it, it is our 83rd year. So my name is Mark Brazel. I'm the executive director of the Windham Championship, and I know Bobby Powell, our new tournament director, is running around somewhere with his head cut off, doing everything that he can. But I'm so proud of Bobby. He's been with me as an operations director for 17 years, and he certainly deserved to be named tournament director, and he's doing a fabulous job. So if you see Bobby Powell, tell him thank you. Also, welcome to this very special gathering, this event, our Executive Women's Day, presented by Cone Health. We started this, I don't know, maybe 10 years ago, 8 years ago, and it's been hugely successful, and we love, it's kind of besides yesterday's Monday Pro-Am that Truist sponsors, this is kind of our kickoff. A couple notes about the tournament. The golf course is in fabulous shape, thanks to John McConnell and his team. And so the players are going to love it. At least for the first 3 or 4 days, it looks like our weather's going to cooperate. We'll have to see what happens on the weekend. Prayers there. Also, our field is very solid. And since my girlfriend was very interested in this guy, Adam Scott is here. That's all I'm going to say about the field. No, we've got some great players. One of the great players of the last 10 years, Ricky Fowler, Jason Day, Justin Rose, defending champion Kevin Kisner. We've got some of the best young players in the world here with us. Will Zalatoris, some other kids that are brand new to the scene. A kid that just graduated from Carolina a couple years ago, Ben Griffin, who's having a great year. We're excited about having him back, or him for his first Windham Championship. Our good buddy Webb Simpson, some of our other past champions like Camilo Villegas, Ryan Moore, Jim Herman's back, but JT Poston from Hickory, who's had a really nice year. So the field is great, and we're very happy with it. Tomorrow is going to be our DeJoy Voss Wednesday Pro-Am. Should be a lot of fun. And the other great news I would tell you is that I always feel real good when we've done a good job of sales. I know it's going to be a successful event. I know that's going to bring a lot of energy to the tournament. But it was a corporate sellout this year. So that sounds terrible, but actually it's a good thing. Before obviously I go any further, there are two companies that are, our largest companies. Our title sponsor, Windham Rewards, which is made up of two companies, Windham Hotel and Resorts and Travel and Leisure. Like Bobby Long says, they're like family to us. It's a partnership. There's no friction. It's just, we have a great time together. We enjoy each other's company. We enjoy doing business with one another. And we're so pleased and happy to have Windham Rewards as our title sponsor for the 16th year. Thank you, Jeff. And we'd also like to thank Truist, formerly BB&T and SunTrust merged. And we are blessed to have them as our presenting sponsor. And they do so much for our state and for our community. So let's hear it for our good friends at Truist. Today's supporting partners are Sunbrella, Party Reflections, and Truist. But I want to get to the presenting sponsor real quick. It's Cone Health. And obviously, if you're from the Triad, you know what Cone Health is. And it's a very successful and powerful friend to all of us here in Greensboro. We're very happy to have Mary Jo Kegel, who is the CEO of Cone Health, with us. This is actually their second year sponsoring the tournament. But we're in the middle of COVID last year. They got very busy, and we did the best we could, but we're so happy to have Cone Health full strength this year with us. They've done such a good job over these last couple of years with COVID, and they've just been such an incredible neighbor to all of us. But interesting thing about Mary Jo, she is the first physician to ever be named CEO and the first female to be named CEO of Cone Health. And Cone Health, thanks to Mary Jo, last year came in as one of our 3 largest supporters after Windham Rewards and Truist into our platinum sponsors. Thank you so much for your support, Mary Jo. Really appreciate it. So today, it's a great honor for me to be able to introduce a good friend, somebody I love working with, and she's an all-star in her industry. And she is the Chief Marketing Officer of Wyndham Hotel and Resorts. Let's welcome Lisa Cecchio.
Thank you. Ooh, so sorry. Hello, everyone. Welcome. As Mark said, my name is Lisa Cecchio, Chief Marketing Officer of Wyndham Hotels and Resorts. And on behalf of the entire Wyndham family, which are sitting up here today, you can see all our Wyndham folks right here. We want to extend a very warm Wyndham welcome to all of you. And what you may not know is that while we're about 200 in this room today, we have several hundred other folks watching in virtually today for the very first time. And so if I may, before we get started, have you all say hello to everyone who's listening in today. Everyone, if you can turn, you can wave to the camera. Welcome, everyone. For what you all can't feel that are watching on the video, it is August in the South, which I don't have to explain to all of you what that means. But if you all hear on the video zooming in a little bit of background noise, we have some big you-know-what fans in here keeping us cool out here today. So I do, again, want to welcome you all. Mark mentioned our title sponsor, Cone Health, but I just thought for anyone who's not as familiar, allow me to give you a little background on them. Cone Health is focused on the health and well-being of every community that they serve. They do this through 5 hospitals, 4 ambulatory care centers, 3 outpatient surgery centers, 5 urgent care centers, and more than 150 physician practices. This includes primary and specialty care through the Cone Health Medical Group and Triad Healthcare Network. Cone Health provides insurance coverage through Health Team Advantage and is a leader in value-based care. But Cone Health's biggest asset is its 13,000 team members, many of you who I hope are dialing in today. By continuing to invest in them, Cone Health ensures nationally recognized healthcare excellence, coupled with a caring, compassionate experience that's second to none. And I'll tell you, I had the chance to spend a little bit of time before the lunch got started with the executive team that's here today from Cone Health, and I'll just tell you, we're really all in for a special treat. This is an amazing group of women who are doing amazing things in our community, just like all of you. Thank you all again for your support. So our theme today is Women Own the Room. It's a powerful and a progressive statement, and one reflective of the incredible potential that exists in each of us. And I don't have to tell all of you because you clearly are all owning the room. And certainly here at Sedgefield, all together in this moment, you are owning that room. Yet as we know, in so many other parts of our lives and in so many other parts of the world and lives of other women around the world, it's just simply not the case. Just look at the US. In 2020, amid the backdrop of the pandemic, headlines were made as the first time in over a decade, there were more women in the US workforce than men. At the same time, we saw and continue to see more women pursuing and completing higher education. An amazing, amazing stat. But yet, underrepresentation still exists in many of our industries. And particularly in hospitality, we're no different. Over 70% of the workforce in hospitality are women, but only 1 in 10 of them are represented in hotel ownership, in real estate, investment funds. And when we look back on the impacts of COVID, they were disproportionately impacted negatively, with so many women having to leave the workforce. So at Wyndham, we are committed to gender diversity, Wyndham's economic empowerment, and advancing women entrepreneurs to help to layer the playing field. Travel and Leisure just yesterday released their ESG report, and we're able to share all of the great strides that the organization is making in not only advancing women into senior leadership ranks, but all of the programs that are in place now from a recruiting perspective and a development perspective to ensure that those women in those future ranks are long into the future of those senior ranks. And at Wyndham Hotels and Resorts, we were extremely proud to last year launch our Women Own the Room program, the first of its kind in our industry, specifically designed to advance and empower women entrepreneurs. And this program is built on 3 key tenets: financial support, operations support, and networking. And I don't need to tell this room the importance of networking. We're all here today to meet, to make our businesses stronger, to make our community stronger, and who knows, maybe find a new friend. And so I encourage you all, before the day is out, to meet one person here who you don't know. Right? Oh, good. You've already met someone here. This is good. We have a winner right here for one. And I'm going to hold you all to it. So if you see me in the lunch line or you see me during breaks, I'm going to ask if you've met someone, because there is nothing more powerful than networking. We hear this from our women developers all the time, that part of the barrier for them was that they didn't know someone. They didn't know anyone who looked like them. They didn't know who to call. They didn't know where to start. And so the power of a community cannot be undersold in what that means to make us all stronger. So on the topic of inspiration, I do have the distinct pleasure, as I said, of welcoming to the stage later today an amazing group of accomplished women who not only own the room each and every day, but are going to inspire us all to do the same. But I'm going to start by introducing one amazing woman, our keynote speaker, to the stage. Dr. Mary Jo Kegel is the Chief Executive Officer at Cone Health. Last year, she was named one of modern healthcare's 10 women leaders to watch in 2021. And think about what that means, particularly what happened in the year of 2020 in healthcare. Dr. Cagle has been instrumental in leading Cone Health to national recognition for quality of care. Her many recognitions include the Nina Griggs Gunter Servant Leadership Award for 2022, the Greensboro Chamber of Commerce Athena Award for 2022, the North Carolina Hospital Association's 2017 Clinical Leadership Award, the National Association of Professionals Women 2013-2014 Woman of the Year, Triad Business Journal's 2014 Outstanding Women in Business list, and the South Carolina Hospital Association's 2010 Lewis Blackman Award. Woo! Let's give. She currently serves on the Health Equity Board for the North Carolina Healthcare Association Center, the Board of Trustees for the Trevecca Nazarian University, and the Reading Connections Board. Dr. Cagle is a member of the Advisory Committee for the Chief Medical Officer Fellowship of the Health Management Academy. She has been married to Randy Mashburn for 39 years, and they have 2 adult sons, Robert and Joseph. And what I shared with Dr. Cagle backstage is I too have 3 sons. There's a special place in heaven for us both. Now, what you heard Mark say also is that Dr. Cagle not only holds the distinction of being the first woman CEO, she is the first physician CEO of the system, which makes her also the first female physician CEO, which in the great state of North Carolina makes her, I think, a triple threat. So it is my distinct pleasure, and please join me in welcoming Dr. Mary Jo Kegel.
Thank you all so much. It's really a delight to be in this place with so many women of distinction. I first wanted to say, really, with so many leaders who happen to be women, right? And with some great men, too. You know, this morning, I want to stop a moment and recognize some other wonderful leaders in Cone Health. Cone Health has had some great women leaders for a long time. We have, in this room, 3 women who've been chairmen of our board of trustees. And that's been going on for a long time at Cone. Carol Sims, who is here, has been the chairman of the board at Cone Health, and now she's come around for a second term on our board. Carol, thank you. Deborah Hooper, who's been a previous chairman of our board, and our current chairman of our board, Mae Douglas. So I want to recognize you 3 women for the leadership that you've given at Cone Health. And so I'm sure if I could know all of the stories here, I'd hear great stories of leadership from women in this room, and those inspire me. Today, I want to share with you all some of my journey of leadership and why this role is important to me and the difference I believe we all can make for this community, for our state, and for the world. And I think it's important for us to do that. I have a personal mission statement that I shamelessly stole from John Wesley, the English minister and reformer who then came to the United States. And when I first heard it, I said, that moves me and I want it to be mine. And he once famously wrote and said, do all the good you can by all the means you can in all the ways you can in all the places you can for all the people you can as long as ever you can. And I thought, Mary Jo, if you could live up to that, what a difference you could make. Your life could have purpose and meaning. And that's what we want, ladies, isn't it? We want our lives to have purpose and meaning. And so that's my personal mission statement. And so as my leadership has evolved, I've thought, how do I live that out? How do I organize that? And so you guys, I'm kind of a list maker. And so I want to share with you 3 ways that I'm trying to make my professional life help me fulfill my mission statement. And those 3 ways are living out the importance of promoting diversity, the importance of creating partnerships, and the importance of giving back to the communities where I live. So I want to talk about the importance of promoting diversity. When I look at this room, not only do I see leaders who are helping us have diversity in leadership from a gender point of view, I look across this room and I see diversity in ethnicity, diversity in skin color, but I also suspect there's diversity in religious beliefs, probably in political beliefs, and those are important too. And why are they important? Well, I'll tell you one of the reasons it's important to me. I grew up in a little town called Jasper, Alabama, which is a small southern town and was very, very typical of small southern towns. I was born in 1959. You can do the math. That makes me 62 years old. I own every one of those years. I've filled them up, so I'll own them. And so it was very typical for the towns of that time. My mom was white and a good Protestant lady, a typical WASP. My dad, on the other hand, was of mixed race. My dad was white, Native American, and African American, in his heritage. So that made us a little unusual for the time in that little southern town. Now, I didn't know that that made me different, and it speaks to the kind of family I had that I didn't know that that made me any different. But in that town that I grew up in, all the doctors in that town were white men. Pretty typical for a little southern town. And our family doctor was a man named Dr. Cary Gwynn, and he was wonderful. I adored him. He delivered all of my siblings, all of my cousins. He took care of everyone in my family, both sets of my grandparents. I thought he was great. And one day, when I was 3 years old, I went to church on a Sunday like our family always did, and there was something very unusual there. There was a lady doctor at our church. I didn't even know such a thing existed. And she told a story about going to India and building a hospital in a region that didn't have health care. So two really amazing things. She was a doctor, and she was going to build a hospital. A woman was going to build a hospital. I was mesmerized by the story that she told. And I was just fascinated by everything about her. She was powerful. She was feminine, but she was determined to build this hospital. She totally caught my imagination. The next time I visited my doctor, Dr. Gwynn, for my regular checkup, I went in and they weighed me, and he walked by, and I said, Dr. Gwynn, when I grow up, I'm going to be a doctor like you. His nurse immediately said, oh, sweetie, you mean you're going to be a nurse? And Dr. Gwynn, who was well over 6 feet tall, but he seemed 10 feet tall to me, scooped me up and said, no, she said she's going to be a doctor. And that started a relationship between me and Dr. Gwynn. He said, when he took me into the exam room, he said, Mary Jo, do you really want to be a doctor? And I told him about hearing that doctor whose name was Orpha Spiker. And in my 3-year-old little self, I just told him all about it. And he said, well, if that's what you want to do, you need to have your mom get you a library card, and you need to start learning how to read. My relationship with Dr. Gwynn continued on throughout the rest of my life. And he became an encourager and a mentor to me. He made a huge difference in my life because he said, yes, you can. In 1962, in a small town in Alabama, this man said, yes, you can do it. And the rest of my family said, yes, you can do it. That's why I promote diversity, because somebody promoted it for me. We have a role to play for young people in our schools, in our churches, in our synagogues, in our temples, when they say they have big, audacious dreams, to say, yes, you can do that, and to encourage them. We have a role to play on our teams when we have young up-and-comers who have big dreams, not to squash them and tell them the reasons they can't do it, but to tell them all the ways they can do it. Diversity is important because, ladies, we are 50% of the talent pool. And in this job market today, who wants to mark out 50% of the talent pool? I can't afford to do that. In this community, in Greensboro, whites are 46% of the community. Non-whites make up 54%. I can't afford to mark out 54% of the talent pool. I need to embrace diversity because I need good talent. I've got to promote diversity. I devoured biographies of famous women when I was a little girl. I still do. I'm still a little girl at heart. And I read one day the biography of Abigail Adams, our second First Lady, and it had collections of her letters to her husband. And John Adams, our second president, but one of the letters was when he was in the Continental Congress, and he was telling her what they were doing. And one of the things she said to him was, I believe that there are a lot of big words being used, but not very many big actions. And I think, ladies, we've been in companies that have been talking big about diversity and inclusion for years. Lots of big words, but not very many big actions. It is time for some action. So if you look at the research on diversity and inclusion, what you find is in companies with women as CEOs, you see action taken and the numbers move, and you see on the boards and on the executive teams that there begins to be 50-50 on men and women. You begin to see on ethnicity, the dial begins to move to an even balance. I think women are so tired of inaction when they get in leadership, they say it's time to move. So I call on you, as you move up, go ahead and say, it's time to act. I'm tired of just talking about policy. I'm tired of just looking at scorecards. Let's change the number. Ladies, let's do it. We can't afford to waste good talent. There's an importance in partnership. I really appreciate talking about what we went through with COVID. During the COVID work, during the early days, we did not have enough PPE. We were flying by the seat of our pants, trying to think how we were going to take care of this really scourge that hit us so quickly. I'm so proud of what our community partners did. Contour was one of them. Mommy, thanks for being here. Contour stepped up and helped make gowns and masks for us. Other companies did the same. There were companies, and some of you represent them, who brought meals to our employees who were working long hours. Trucks that sat outside and had coffee for coffee breaks for our employees. Companies who did artwork on the sidewalks to encourage our employees. Recently, when we were going through a hard time, the Arts Council commissioned a poem that we were able to include for our employees during hospital week to thank them and encourage them for their work. Partnerships helped us make it through that time. I loved hearing Mark talk about the partnerships that have made this tournament a success. We just completed our required triennial patients and community needs assessments for the counties that we serve. The two top needs that we've identified in the counties that we serve are safe and affordable housing and food security. Can I tell you, Cone Health does not have the resources alone to address that. It will require partnerships. And you guys, people can't be healthy and well if they don't have a safe place to eat and they don't have healthy food. One of our generous philanthropists, Denise Brito, is here. She and her husband have helped us start a food pantry and have helped us begin to identify partnerships so that we can address it, but it's just the beginning. I wonder what partnerships we can begin to create to address the housing needs in our community. If we're truly going to create and address health equity in our communities so all of our citizens can have adequate health care, reasonable health resources, and instead of having one of the most unhealthy communities in the United States, begin to have a truly healthy community, it is going to require partnerships. This is something we can do together. More than that, it's something we must do together. If we're going to continue to attract businesses and have a workforce that is sustainable. And I'm just optimistic enough to know, because of what companies did for Cone Health when we were in crisis, to know that we together can partner and make that happen. And finally, because all of these are connected, the importance of giving back. I had the privilege a couple weeks ago to speak at an event sponsored by our local newspaper where they recognized women who had given to the community, and they named a Woman of the Year. And I had the real honor to talk about a very significant woman who I know who had given to her community in really remarkable ways. And her name is Mary Aydah Sammons Stewart. You probably have never heard of her. Her community calls her Miss Mary. I called her Grandmama. I was named after her. Miss Mary grew up in eastern Kentucky, close to the West Virginia line, in the area that's having severe floods right now. My grandma was born in 1908. She was one of 7 children, the oldest girl, the second child of those 7. And they lived in a 3-bedroom log cabin that had no running water and no electricity, and had a well, a hand-pumped well on the front porch, and a 2-seater outhouse in the backyard. And it was a coal company town. A town's too big a word, you guys. I'd call it maybe a village. It had a post office. It had a company store, you know, that you could buy things there, but it would be put on your paycheck, right? A company store. They also had a garden out back, so they did subsistence farming, right? Some hens for eggs. Because she was the oldest girl, that meant that she helped raise the kids, because there were 7. By the time I came along, my brother and I, we would go visit in the summer. There was a big house up on the hill that the youngest child, my great aunt Anna, and her husband had built, that my pappy, that's what we called my great-grandfather, had moved up to, because he was in his 90s by then, and it had all the amenities of electricity and running water and indoor plumbing. But we thought it was so fun to go visit that log cabin, and we always asked to spend the night there. And my grandmother would roll her eyes. She said, "You wouldn't think it was so cool if it was wintertime." My grandmother apparently was pretty smart. She finished high school early. The schoolhouse that was there was a 1-room schoolhouse. It went through the 8th grade, and then when you finished 8th grade, you rode the bus to the county seat to finish high school. She finished high school at 16, and the community and the coal company needed a school teacher, and they paid for my grandmother to go to the Kentucky Teachers College. And she got a 2-year degree in teaching and came back and became the teacher at that 1-room schoolhouse in Hitchens, Kentucky. She taught every child in that community, including all of her younger brothers and sisters, in that 1-room schoolhouse, 1st through 8th grade. I used to say, like Little House on the Prairie? She said, "Oh, they make it seem much nicer than it really was." And so she taught 1st through 8th grade, starting at the age of 18. And from 18 to 23, she taught all of those little children in that little building. She had to walk to the schoolhouse. There was a pot-bellied stove. She would start the fire in the wintertime. At 23, the town had gotten a little bigger, she said, and they hired a second teacher, so she only had to teach 1st through 4th grade, and the other teacher taught 5th through 8th grade. She said that was so much easier. When she was 26, a young man moved to town He was single, and he was the preacher at the church. My grandmother happened to be the treasurer at the church because she, as she said, I knew how to keep the books and I knew the numbers. And I made sure he got paid. And she said, but it wasn't always in money because we were a poor little town. Sometimes he would get eggs or a hen, but he didn't know how to cook. And so sometimes I cooked for him. And that was my grandfather. It was kind of scandalous when the teacher, who was also the treasurer, and everybody thought she was an old maid by then because she was 26. They hit up a romance, and he married her and took her away from that life of teaching. And eventually they moved from that little town, and she continued to teach. She taught 4th grade because that's what she liked best, and she thought it was so much easier just teaching 1 grade. Can you imagine? When we went back many years later, after she'd raised her children and had grandchildren, we would go back and visit my great-grandfather in that little bitty town. And it was so small, we could walk down the one main street and walk to the store and get a Coca-Cola and some peanuts, or that's what I remember getting there. Walk and send letters at the post office. I met everybody in town. Everybody would stop and say, are you Miss Mary's granddaughter? And I would say, yeah. Everybody knew my grandmama. And they would say things like, Miss Mary taught me how to read, and that's why I have this job. At the store, are you Miss Mary's granddaughter? Like, yeah, I am. What's your name? Mary Jo. You're named after your grandmama, aren't you? Yeah. Well, I wouldn't have this job if it weren't for your grandmama. She made me practice addition and subtraction until I could do it, and that's how I got this job. Went to the post office. The postmaster said, are you Miss Mary's granddaughter? I said, yes. You have her same brown eyes. I do, yes. She was so kind to us. She's the reason I have this job. And then he laughed and said, she may be the reason I'm alive. We were so poor. There were days I didn't have a lunch, and she would give me half of hers. Everywhere we went, everybody knew my grandma. The one policeman they had in that town knew my grandmama, which means we couldn't get in trouble. When my grandmother passed away, all of her siblings came. And she'd really been like a second mother to them. And after her mother had passed away, she still continued to mother. And they talked about, do you understand how special your grandmother was? How much of her life she gave up to take care of us, and how much she gave back to that little town after they sent her to college. And I looked and I saw that my mother had been a kindergarten teacher, and my uncle had gone on to college and to seminary and been a minister, and my aunt had become a nurse. And I thought back as growing up, all the, we'd get together and we'd all be playing games, but it would be like Scrabble, and not only did you have to spell the word, you had to define it. Who made up those rules? My grandmother. Or some numbers game. And she would always say, your education's important. And I look at her grandchildren, and there are teachers, and there are business owners, and there are engineers, and there are master's degrees and PhDs, and there are a doctor with CEO. Because that woman gave back. Do all the good you can in all the ways you can. Whenever you can. And all the times you can, by all the means you can, to whoever you can, as long as you can. Ladies, if we can do that, if we can pay back all the good that's been given to us, we can change this community. We can change the state. We can change the world. My grandmother changed my world. She changed that little town of Hitchens, Kentucky. I wonder who's changed your world. And don't you want to give back because of them? Thank you for being here today. Let's go change the world.
Dr. Cagle, I speak on behalf, I know, of everyone in this room and everyone watching that you are our Miss Mary. And while we didn't know your grandmother, we're very lucky to know you, and thank you for your leadership and all you're doing in our community. All right, everyone, we're going to break for lunch now. It's as you wish to go over. We're not going to call numbers or anything like that. And Tevin and Minia are waiting in the back with cold drinks for everyone of your choice. And for everyone who's listening in, we'll be back around 12:30. Woo! See, now the wind is coming. We'll be back at 12:30 if you want to have lunch as well, and come back for our moderated panel discussion this afternoon. See you all then. All right, we ready? All right, everyone. All right, everyone. This is the hardest part of this role today, is having to break up conversation. It's like the last thing I ever want to do. What Dr. Cagle and I were actually just talking about is, by sharing stories, that's how you really connect with people. And just walking by the tables throughout lunch and hear you all share your stories. And Dr. Cagle has some amazing stories, even from our own table, that she was able to uncover. And so thank you for sharing your stories. Thank you for making us stronger. I hope your business card holders that are on your table are full of business cards from all the networking you've been doing. And we're ready to get started. And hello to everyone coming back on the Zoom. I now have the distinct honor of welcoming our panel. First and foremost, I'd like to invite Mae Douglas, Chair of the Cone Health Board of Trustees. Mandy Eaton, Chief Operating Officer of Cone Health. Dr. Valerie Lushberg, System-wide Chief Medical Officer for Cone Health. Michelle Adamolekun, Chief People and Culture Officer for Cone Health. And Dr. Mary Jo Kegel, CEO of Cone Health. Talk about action. To look at all of this diverse panel. Thank you, all of you, for joining us today. I thought maybe we could just start by you all introducing yourselves, your roles at Cone Health, and maybe just a little bit of what brought you to the seats you're sitting in on this stage today.
Shall I start?
You would love you to start.
Okay, terrific. My name is Mae Douglas, and I am actually a native of Greensboro. Grew up here and a proud graduate of Dudley High School, for any of those out there. After graduation from Dudley, I attended UNC Greensboro, so any UNCG folks out there. And then I actually started my career with the city of Greensboro. I had gone to the city during the summers as a teenager, working for the Youth Council. I don't know if anybody remembers the Youth Council, but I had worked with them during that time. Okay. And I was working in the Human Relations Department. And at the time, the Human Relations Department was working on a proposal to the city of Greensboro to create the Commission on the Status of Women. And so I was working with part of that. And I don't know if you guys remember Kathy Sebo. She was actually the leader of the committee that did that work. And as a result, the proposal was to establish the commission and also to have a city-paid position to lead the commission. So I was the first leader of the Commission on the Status of Women. And I was this 25-year-old young black woman who didn't know what I was doing. But if it had not been for Jim Melvin, who was the mayor of Greensboro at that time, I would never have been in that role. And so I am currently retired. So I worked for the city. Later, Ciba Geigy relocated to Greensboro. I worked for them for almost 18 years, both here and in Westchester County, New York, and left there and then moved to Atlanta, where I worked for Cox Communications for almost 20 years. So my career has been Human Resources Chief HR Officer. So I've always had an interest, obviously, in women's issues, issues of equity. I believe that's part of my calling, and being the Chief HR Officer, having the influence and the opportunity to impact policies, organizations, structures, pay, you name it, for everyone. And so that's sort of my story. I retired 10 years ago, moved back home to Greensboro, and for the last 10 years, I have volunteered on various boards and commissions, and I feel it has allowed me to better understand the issues in our community. And I get more excited about it every single day, that I know that I'm helping to improve the lives of all of our citizens here in the community. So that's my story.
Wonderful. Thank you, Mae.
Super hard to follow that for sure. I'm Mandy Eaton, our Chief Operating Officer for Cone Health, and I've been with Cone Health for 22 years. So 14 of those were at Alamance. Hey, Louise. 14 of those were at Alamance Regional prior to our merger with Cone Health. I was really inspired to be in healthcare at a very young age. My grandmother, my Grandma Ruby, was my caregiver after school. Most days I got off the school bus at her house, and she was a pediatric nurse. And while I never really had the intestinal fortitude to be a clinician like she was, what she taught me was service to others and giving of herself in a bigger and greater way. And so that really stuck with me for a long time. I went to school in Chapel Hill to study public health, and then later studied healthcare administration. And I ended up in human resources as an administrative intern. Was my very first foray into healthcare. So I say that human resources found me. I did not go in pursuit of human resources, but I absolutely loved it for all the reasons that Mae described. And I spent the majority of my career in a variety of healthcare HR functions. I've had 10 jobs with Cone Health, which sort of would make you feel like I'm a job hopper, but it doesn't really feel that way. And most recently, this last year, I transitioned to the Chief Operating Officer role when Mary Jo took on the role of our CEO. And so you also might think, well, that's a pretty sharp left turn, but frankly, the work that the Chief Operating Officer does is really rooted in everything people and culture. And so I feel like I've got 20 years of training that positioned me to be in this role. So glad to be with you all today.
All right, this is always a hard thing to summarize quickly, a journey that obviously has taken years to achieve. My name is Valerie Lushberg. I'm the System-Wide Chief Medical Officer for Cone Health. It's a role I've been in for the past year. And to do a quick summary of here to there, or there to here, I should say. Born in Texas, did all of my growing up undergraduate medical training in Texas, specifically University of Texas, Houston for medical school, Texas A&M for undergraduate. Came to North Carolina as an opportunity for residency. After medical school, you go to a specialty of training. I chose internal medicine, which is traditionally extremely male-dominated. And I did so at a time at the new century when we were promoting the first era primary care under Clinton. And so to choose Cone Health, Greensboro, as a place to train for primary care and internal medicine really just felt like an opportunity for me that has worked out. I fell in love with our area, our community, the people I have the opportunity to serve with. As you might imagine, medical school training is not the same as business or executive training, and that happened along the way through roles that I did in my clinical work, taking on leadership roles for both my clinical team, helping lead teams of APPs, PAs, and nurse practitioners on our hospitalist team, then moving into the primary care office setting, where I was one in a group of 6 internists, the only female, which very dramatically shaped my patient population based on request of who people wanted to see. Started to really gain an idea of what I brought different to the table, brought different to the room than what my other colleagues did. And in that leadership role of not only being a standout because of a woman in a male field, but also a physician, learning to speak business language, executive type roles that could advocate for our patients, and the meaning of the impact of health outcomes really brought me to a place that then coincided with Dr. Kegel's arrival at Cone Health, where she really wanted to help develop specifically physician executive leaders. And it really then became something through that advocacy that I began taking coursework, training, and what does that look like? How do we build teams? How do we lead teams beyond just that of which I had learned through my medical training? So my first executive role formally at Cone Health was in 2015 as our Chief Medical Information Officer, a field within information technology, clinical informatics, again, IT largely male-driven, at least historically, and so it's really something that I think even outside of healthcare, certainly you all can relate to the value you bring to the room as a woman that is a perspective that you should celebrate and make sure is heard. I'll stop there just in the interest of time, but thank you.
Good afternoon, everyone. I'm Michelle Adamalakin. For those of you who are trying to figure out how to pronounce that wonderful name, it's pretty phonetic. It's Adamalakin. And my maiden name is William, so I never had to spell it. But now I just start off spelling it. Michelle, A-D-A, and we go from there. I serve as the Chief People and Culture Officer at Cone Health, and for me that's a blessing and a gift that I do not take lightly. You know, I translate that Chief People and Culture Officer title to Chief Listening Officer, right? That's my role, is to listen and listen attentively. You know, I can share that my journey, I'm originally from Jamaica, West Indies. So I'm an island girl, so I do oxtail and curry goat, all the things that make most people cringe until you taste it. But I'm originally from Jamaica, West Indies, grew up there, and you know, my grandmother truly was what I would call my inspiration growing up. She was a spiritual woman, and I think, you know, she really set the foundation for me as well, as it relates to who I am today. And so for that, God rest her soul, I am blessed to have had that experience with her. I did matriculate and move to the United States in my teens, so went straight from Jamaica to New York. Can you imagine the culture shock? And lived in the Bronx, New York, and really enjoyed the I'm glad I actually moved from Jamaica to New York first versus Jamaica to somewhere else, because again, I think it really built my resilience, which is what I knew I would need, and what has served me well to this day. So came to New York, did my you know, formative years there in school, and then accepted a track scholarship to the University of Texas. So I'm a Lady Longhorn. I need some oohs. Show me some love. And so actually ran track at the University of Texas, 2 national championships. And you know, as I look back, it really, you know, speaks to what sports did for me growing up. So coming from Jamaica, a couple of things that was different and unique. Everyone I saw in positions of power, in roles that were, you know, able to impact the country looked like me. So it never fandom, I didn't even think about, oh, I can't do it. It was always when I do it. So I approached life in the U.S. that way, and I think it served me extremely well. Didn't see the barriers. If they close the door, I'm going through your window. If the windows are closed, I'm digging a hole. I'm coming through your floors. And so, and also athletics really provided me with the foundation to be able to lead, and I definitely take that as a blessing. As I entered the workforce, I've worked in 5 different industries. I've worked in the financial industry at the New York Stock Exchange. I've worked in the, education at University of Texas. I've worked in the high-tech space. I've also, had the opportunity to be in healthcare insurance and now healthcare. So I transitioned to healthcare in 2007, and I would always compare and contrast the high-tech industry, where I was really born and bred from a human resources standpoint. I call high-techers neck uppers, right? We make decisions with our brains, and we've got to force ourselves to pull the hearts in. I'm gonna keep saying we, so I don't offend anyone. And healthcare I see as neck downers, right? We make decisions with our hearts. And so I really got drawn and called to healthcare because I really saw an opportunity to blend both your heart and your minds to everything that we do, especially when we have such a critical role as it relates to our society. Having grown up in high tech, for me, we had 0 defects, right, in our chips, and that was an expectation. And so coming into healthcare, it's like we want 100%, right, satisfaction, and anything less would be uncivilized, if you will. I'm proud to have 2 wonderful children. My husband's Nigerian. We've been married for about 26 years. And, so we call them Nige Americans, a new breed. And, Cone Health, having worked in healthcare and entered healthcare, I worked for Ascension Health, which is one of the largest Catholic healthcare entities in the U.S. 170,000 employees, started in Austin, Texas, and got my foundation there. And then I took on a regional role, where I was had oversight for the Florida, Alabama market, had from where I sit 4 boards that I served on, 4 executive teams, 4 health systems. So in case you're curious, I love challenges. I run to the red. And I left there because I realized while I gained lots of experience with Ascension Health, I was not connected to the community. Right, I was constantly moving from system to system, and I was not able to really build ground and really be a part of the community. And so my mission was to get back into a local healthcare system. And so moved to Wilmington, North Carolina, and was a part of New Hanover Regional. They had announced that they were about to consider a partnership, and I'm thinking, yes. My husband's like, no, like, yes. So really was a part of that team working to, at least get that asset purchase agreement to really bring together Novant and HRMC. I heard a lot about Cone as a regional player in the market because of the CEO, and our CEO at New Hanover were very good friends. And I would hear about the culture of Cone. And for those of you that have an HR background, having a good culture is foundational. And so when the opportunity presented itself to be a part of this illustrative team, I couldn't say no. I came in, interviewed, wanted to meet the team. Organization espouses great things, but do they live it? And I've been truly blessed to date. 8 months in, everyone says you're still in the honeymoon period. I'm like, yeah, but it's been a good honeymoon, and it continues to be one, because they truly do live, right, the mission, and they really do provide that brand promise. And so it starts at the top with the board and with our CEO, and it cascades its way all the way through. So that's a little bit about my story, and thank you.
A perfect segue actually to my first question for you, Mary Jo, which is, we talk a lot, Cone Health is such a pillar in the community. Why is it important? I mean, clearly all the same gender here, but the diverse backgrounds, just listening to you all share how you've come to this point. Thank you all so much for sharing your stories. Why is diversity, why is it so important to you? A lot of also new people in roles, including yourself over the last year or two. Why was it important for you to have, for the community to see diverse leadership in your leaders?
First and foremost, I think diversity is important for the community because it breeds trust. People in our community need to see people who look like them in leadership. Women need to see women in leadership. People of color need to see people of color in leadership. It also is important because no one person, no one ethnic group, no one gender, no one religious group, no one political voice is going to have all the answers for the issues we're trying to solve for our community. I need multiple points of view at the table to solve the difficult issues of this time. The community, you guys know that. And so it's important for the community to see that I have a variety of well-trained, diverse voices at the table who are helping to solve and advise. Whether that's my board of trustees, whether that's my senior executive team, or whether that's the leaders of the various hospitals or medical centers. No one of us is as wise as all of us when we get that right group of diverse voices at the table. And then finally, if we're going to continue to make our communities the place that attracts businesses and have great growth, then we need to be developing talent, a talent pool. And I don't want any young person in our community to think they don't have a chance to be leaders at these businesses. And when they see faces that look like theirs, then they can say, well, if Michelle Adama-Lekun can be an executive, if Mae Douglas can be the chair of a board, then I can too. And that's probably the most important reason to have diversity.
That before I came on the Cone board, I was serving on other nonprofit boards in Greensboro. So September will be 4 years I've been on this board. And to talk about the strength and the power of the Cone culture, I had interacted, Mandy was one of those, but there were other executives on other boards that I had interacted with before I knew anything about Cone. And I could tell what this culture was by the people I interacted with, by their conversation, by their demeanor, by their behavior. Of course, you know, they were smart as whips. So the culture was not just entrenched inside, but when the executives were interacting in the community, I could tell a lot about Cone's culture, and I think that speaks to the work that actually started under Mary Jo's leadership when she was COO, because I could sense that and hearing the executives talk about what was going on in Cone, but more importantly, Cone had leaders on most of the high-profile boards in this community, and also they're giving back into the community, not only through service, but also their philanthropy. I could tell what this culture was before I became a part of the organization.
I think we can all, even just spending the afternoon with you all, just can really just get a sense for who you are, how important culture really is to you, and how much you care about each other. So thank you, Mae, for sharing that. And Michelle, I actually have heard you say that your team members are your most important asset, the most valuable asset that Cone Health has. Can you talk a little bit about how you nurture those team members? You just talked about, Dr. Cagle, about wanting to make sure that young people are attracted into this organization, how you focus on diversity, how you're focusing on education and attracting talent.
Well, it starts, again, from how we attract and recruit individuals into the organization. We want the best, first and foremost, and really making sure that we are able to articulate what we're about. We put the patients first. And so we're looking for individuals that can put themselves second and really align with our strategic imperatives and really support our intentions and our missions. And so, from where I sit, it starts with recruitment. Once we bring those individuals into our organization, it's really important that we fulfill our commitment to develop them. And they have some ownership there as well. But it's a partnership as it relates to those teams. And then we've got to listen, right? We've got to listen to them to understand where there are opportunities, where there are gaps, and be able to work in partnership with them to bridge those gaps, to really create that organization where they feel like they belong, and they are respected, they are supported, and they are valued. And that truly creates the environment for us to really achieve creativity and innovation, right? That truly is our competitive advantage from where I sit.
Thank you. And Valerie, congratulations on being named to the Triad Business Journal 2022 list of outstanding women in business. I did not hear that in your introduction, so I'll just do a humble brag for her. You have been so successful in your career now, rising not only, I heard you say internal medicine being the only woman in the room, IT being the only woman in the room. What do you think is the most significant barrier to female leadership that may be different from male counterparts who you've been surrounded by?
So I think for me, I would say one of the greatest challenges is still our own social perceptions. I think the way we think about gender, the way we approach gender is so pervasive in our society as well as the culture of our work that it takes a conscious mind to see it and be ready then to address it when it's not given an equal par footing. We know the examples of men in a room speaking as powerful and assertive and knowledgeable, and a woman perhaps saying the exact same thing is seen as loud, bossy, another B word. Things that are in our head of the perception. So the social perceptions of what that occurs, and asking ourselves as well as being able to kindly ask others, would you say that if he were a woman? Would you say that if she were a man? So I think that's one of the things. I'll also use an example. I spoke of my patient care. When I moved from caring from patients in the hospital setting to having my own patient panel in primary care as an office setting, part of that is relation building with your patients. And through very good intentions, I was often asked by my patients personal questions, one of which struck me most often: what does your husband do? I would ask my counterparts, how often do your patients ask you what your wife does? And very few of them could ever say that, even be asked that. And it really just struck me as something that my value, even standing here where they know I am their physician, they know that I've done the same training as anyone else. In fact, they chose me because I'm a woman, wanted to relate to something because of what my husband did. I'll also just add to that same gender, it was an awkward question because I don't have a husband. I might be single, but in my case, I have a same-sex partner. And to be able to take that question on and be able to address and let people know who I am, own my whole self, and still make it a comfortable space where you perhaps are there for me on what you need, was a very delicate balance that I think women have a sensitivity to that we need to be really proud of. And so consciousness of what our gender biases are, and advocacy for that is something that I think not every man experiences in the same way, and that's not to say they can't.
Right. And to that same point, how important is advocacy from your male counterparts?
Yeah, I'll tackle that. I think we all know and understand that men are the largest number of decision makers in any and every organization or sector across the country. But my experience also is that they are willing to be teachable. And that is one of the roles that I took on in both organizations that I was a part of. And so I see the advocacy sort of in two areas. One is the area of sponsorship and mentoring, and the other is understanding this issue of gender equity, as Valerie referenced. And when I talk about sponsorship, I spend a lot of time with our executive team talking about and helping them understand and actually implementing sponsorship. And sponsorship is different than mentoring. I think you guys know that. A sponsor is someone who has the ability to hire, promote, get you hired, or speak up on your behalf. And so one of the programs that we implemented was each member of our executive team, and we specifically established it as a program for people of color in our organization, had accountability for one person who was on the high talent pool. And as a result of that, we saw the number of promotions and individuals getting special projects and international assignments go higher as a result of that. So I think that we need the men, but I also think oftentimes they want us as women to give us their perspective, because several of my male colleagues oftentimes said, Mae, I'm clueless, so I need help. And so I think the opportunity for us as women with our male colleagues to actually talk with them about how they can be more supportive, I think is important, that they be sponsors, that they be mentors. The other thing that I saw is once a lot of the men had daughters who became out of college and then started their careers, they became a lot more sensitive to a lot of these gender equity issues. And it was interesting the number of conversations I would have with my male colleagues because of an issue that their daughter experienced in their work environment. So I think there's an opportunity, again, to offer a female perspective in terms of the gender equity, why it's important. And as Dr. Cagle mentioned in her comments, it's about then taking action and not just talking about it. And I think that's where we as women executives can exert a lot of the influence and power that we have. There's a lot of positional power in this room. And so to the extent that we can use our voices and our influence and our positional power to advance gender equity, we need to do that, because we can't do it without the men.
And Windham agrees, we can't do it without the men. We're very proud to have representation from our allies here with us today, and membership from our board as well. Thank you, Luis, for being with us today. It is something that we are very mindful of. Representation does breed just more opportunity. And so thank you for that answer, and commend you on all you're doing. And, I think to that point, we've talked a lot about diversity to this point. I feel that diversity is something you can see. Right? It's the way you look, it's your skin color, it's your ethnicity, it's your gender. But so much of creating environments where people can bring their whole selves to work is by making them more inclusive. And those are sometimes the things you cannot see. And I've heard, Mandy, you've talked a lot about the mental health and physical health and bringing the two together, and how you as an organization are very focused on making sure that it's inclusive as well as diverse. Would you share with us
Absolutely.
a little bit of that?
That's a great question, and one that gives me the opportunity to really showcase the leadership on this panel, because I would say that the work between diversity and inclusion is a journey. You don't get there overnight. You don't get there without a lot of intention, and you certainly don't get there without leadership at the top really showing us the direction. And so I think that what we've done well at Cone is, and you've heard a little bit about this, you've heard that we've built structure around our work, but we've also built ways of being deeply embedded into our culture. So I'll talk a little bit about structure for a little bit. Probably we've been on this journey for maybe almost a decade, and we got very serious about it about 5 years ago and invested in a diversity and inclusion office, dedicated resources, and a chief inclusion officer whose first order of assignment was to go out and listen to the organization. And in doing that, she and her team got over 4,000 voices into this conversation. So we heard from all across the organization, where are we doing things well and where are our gaps? And with that information, we then put together sort of a strategic framework or a roadmap forward. And that's been an evolutionary process, but we used the voices of our teams to build that. I thought that was a very important thing to do. Through that work, we did very intentional education with our team members and our leaders around our own biases, around cultural competency, around understanding differences and embracing those differences. We created structures for collaborative space. We have a book club that touches all of our organization, and we pick books that are related to what's going on in our society. There, we pick books that are about different cultures and different issues, and we use that space to have conversations where people can feel safe. Safe to ask questions about things they're not clear about, safe to express their own points of view, and their journeys may be similar or different, that sort of thing. So there's a number of structures like that, and then probably the most important structure we have in place is our measurement. Because you have to, if it matters to you, you have to measure it. So for several years, we have measured the diversity of our leadership team. We recognized, our board sort of called us out that, gee, your leadership team doesn't reflect your workforce and also doesn't reflect your community. So we went to work on that, and we've done that in a very structured and organized way for many years. We've been moving the needle on that significantly, and we have hardwired practices. So every leadership candidate who comes into our organization must be interviewed by a diverse panel of interviewers. And then every recruiter knows that every leadership position must have a diverse slate. And we're not talking about one diverse candidate. We're talking about a balanced, diverse slate of candidates. And we keep recruiting until we find diverse candidates. They're hard to find sometimes. We work really hard on that. So that's an important measure that we've had in place for many years. I'll also call out that last year we had the opportunity to allocate a portion of our COVID vaccinations to underserved populations, and we did that with the work of our board. We set a goal of 35% of our COVID vaccinations would be allocated to community members who are Black or brown. And we actually exceeded that goal. I don't know, we hit 41 or 42% of our allocation was attributed to those community members. So structures are important, intentionality is important, but our ways of being are probably equally as important. You've heard a lot about our culture, but our values and our commitments to each other are rooted in a framework that embraces belonging and diversity. And in addition to that, we hold ourselves and each other accountable when we aren't creating environments where people can have their voices heard, or we aren't creating safe places where people can feel like they belong regardless of their beliefs or values. That's not just important to our workforce, it's important to our patients as well. They need to know that they can be cared for regardless of their beliefs and values in any of our organizations. So it's a balance. As I said, it is started at the top. We've been fortunate to introduce and embrace diversity in our board as well as our executive team, and it starts there.
What I've been so struck by is not only the roles that you all... What I've been very struck by is not only the roles that you all play in your executive leadership roles, but the roles you play in your community, not only Cone Health in the community, but your own personal passions in the community. And the room is filled with executive leaders and women in business in this community. Mae, what advice do you give to other women, and what about getting more involved in their community? I think when we all look at our schedules every day, kids, camp, school, husband maybe off to work, or a spouse or an elder parent to take care of on the drive, you're calling them, and then you're at work, and then you're all the other things that are running through our minds all day long. How do we find time for community, and why is it important?
I think in a community like Greensboro, compared to when I lived in New York and when I lived in Atlanta, I feel that I can see the impact of my work. So I think for me, it starts there. I can get my arms around the work. I like the size of Greensboro. I like the quality of life we have in Greensboro. There is tremendous economic momentum now going on in Greensboro. And so I think the opportunity to continue to show the new businesses that we expect to recruit in the future, as well as the ones who are already here and have built this community, it has to have community support. And so what I say to people is, look at the results of what is happening. I do want to call out, Susan Schumacher. I saw Tracy. I don't know if she's still here. Yes. Stokes Ann. These are all women in the Cone market who manage our foundations. And when I went up to the Cone Health Foundation board for the first time, I had no idea how they were touching the uninsured, the underserved. And so every person in this room, I think, can make an impact, because the desire, I think, is that we all improve the quality of life for everyone. And I forgot who made the comment earlier about the population of Greensboro has shifted. We are now a BIPOC community. And so, like many communities across the country, I think we want to make sure that every citizen in our community has the opportunity to live the quality of life that allows them to meet their family's goals and desires. And so I advocate, just serve on one board, and I think everybody here probably serves on multiples, but that would be my encouragement. And I think part of it too is reaching back to a younger generation to get them involved in philanthropy. That's what I did with my nephew. He's 37 now and just had their first baby. But I've been talking to him about philanthropy ever since he graduated college. So I think there's an opportunity also to get people involved early in philanthropy and giving back, as Dr. Cagle talked about, but more importantly, seeing the impact of the work. And I think in a community like Greensboro that is so caring and it's so giving, we have the opportunity to improve the lives of our community for everyone.
Wonderful, thank you. And to that point, are there any questions from the community, from the audience? We have a couple mics. Yes, please.
So my question is, I have been listening to a lot of diversity and inclusive among the panel right here. And one of the things that I always hear is equity and equality. And I feel like those two are absolutely, while they are two different topics, they still need to be together. I put different things that you talked about, like diversity, I put it in the bracket of equality. And then when you talk about having women in the same level as what is expected of men, I think about it as equity. So my question is, how do you bridge that gap, equity and equality, and bring them together? Because one of the things I feel, to what Valerie was saying about women's assertiveness in a meeting is looked upon as being the B word. But I also feel like because there is that equity deficit, I feel like there is a requirement from a woman to be assertive. So my question again is, how do you bridge that gap of equity and equality and bring them together in the same level so that we don't talk about these kind of issues?
So I do think, from an equality point of view, that there is not a talent deficit, and that we all have equality of skills and ability. The equity issue is that many times, if this were a race, that the starting blocks are not at an even place. And so we're not starting from the same place in the race. And that's the equity issue. The skills point of view, there's clear equality. But the equity issue is the starting blocks aren't at the same place. Whether that is because our networks aren't the same, we don't know the same people, we haven't played golf with the same people, so our network isn't the same. We haven't gone to the same prep schools, we haven't been introduced, or the neighborhoods where we grew up weren't the same. Whatever it is that put our starting blocks for this race at a different place, that's what created the equity issue. And so that's why women have had to speak louder, the assertive or aggressive, whichever word you want to use, issue, or people of color, all those issues. So how do we address that equality, equity gap. I think Mae addressed this when she talked about sponsorship and programs, mentorship programs. That's one way to do it. I think we have to be intentional about uncovering what are all of those things that have created that gap in the starting blocks, so that you could begin to say, how do we move those starting blocks close together? Because I do believe that there is equality in the skills, but there's not equity in the starting blocks in this race.
I'll kind of expound a little bit. Go on. Diversity, equity, inclusion. Those are three distinct elements that you've got to attack in different ways. Diversity is around the differences. We're all diverse in this room. Different backgrounds, academic, the obvious and not so obvious differences. If you think of society as fabric, each of us are the threads, right? Unique threads that create, right, the fabric of our society. Equity for me is, when I think about it, it's really about the ability to meet folks where they are. If we really believe that we're each diverse and unique in who we are, then that would say we're in at different points. And so it's really about creating within the system, removing barriers and creating within the system ways, right, actions, processes to bridge gaps so that we all have an equal opportunity to achieve the end results and outcome, right? So, and an inclusion is around belonging. I would say that's the hardest part of the equation, right? Because we are always going to be learning. We've got to be comfortable in never arriving, because everyone has different elements that they bring to the table. So you've got to be able to deal with ambiguity. If we say we're different, why are we surprised we have conflict? Duh, right? We see things differently. And so from where I sit, that bridging for me is equity is around, again, making sure your systems remove barriers and constantly assessing those systems, asking the questions, finding out from others, where do you see barriers for you achieving your goals within our system, and working to bridge those to ensure that everyone has an equal chance for success. So that's kind of how I do it in my head.
One more right here. Mandy, please.
Our philanthropy team is here. I'll just brag on them a little bit. They're beginning work in looking at programs and partnerships that we're going to participate in and sponsor through an equity lens. And that work is a powerful gesture of what Michelle just described. We've also had our construction teams who have begun projects, most recently a project out at Alamance Regional, and they only took RFPs from construction companies that also had DE&I programs in place. So our pursuit of spreading this work and ensuring that equity is present isn't just about being in an organization, but it's also how we engage with our community as well. I just want to say one quick thing about this idea that we have to be like men and we have to be assertive. We do not, because every one of us has superpowers. Right? We have superpowers. Mae talked about her superpowers. I could give you a superpower from every woman on this panel. I won't waste your time with that. But if you do not know what your superpower is, ask people who work with you what you do well, because they likely see something in you that you may not see in yourself, and use that superpower. And I think that's a way for us to know that we don't have to be inauthentic, right? We can be who we are because we have superpower.
I would say if we're all the same and we all think alike, I'd probably say we have one too many people, right? I mean, I don't do, at least one. Mini-me's are not a part of the job description, right? We've got to own the fact that we bring perspectives, right? That is what we bring to the table, is our diversity of thoughts. And that's important, and that's enough to get you to the table, right? One of my mentors always told me, if you're not at the table, then you're definitely on the menu. And so, again, we've got to own our perspectives and be able to share that with everyone so that you can feel that you're providing value to the organization. So
This is so rich. Add something to it, because Michelle knows this is what I ask of my team. I say many times, if we're all agreeing on a tough topic, then somebody is in excess in the room. The point of diversity is to hear many voices, and they shouldn't all be the same, because we're trying to represent the community in which we serve to solve hard problems. At the executive and board level, only the most difficult issues should arise, and we should struggle with them because they're hard issues. And that means I need every possible point of view. One of the things our team is working on, my executive team, is how to really rumble constructively, how to get all points of view on the table and to go at it until we come up with the best solution to hard problems. Hard problems should be hard to solve. They shouldn't be easy to solve, right? And that's why I need diversity of thought at my executive table, because they're going to help me come up with a better solution than certainly I could do on my own, but that any one of us could do on our own. It'll be better for that. And I love that.
The other areas I do want to highlight that I think this community needs to be aware of coming out of COVID related to DEI is the fact that we're developing a clear health equity strategy as well. All during the pandemic, we heard about all of the differences in care and health of Black and brown people versus others. And so I am so pleased that coming out of the pandemic, Mary Jo and her team are clearly focused on a health equity strategy for our community. And I think the community needs to hold Cone Health accountable for that. Because as I said earlier, if we are not making progress in the health and improving the lives of all of our citizens, then we're not doing what we should be doing as a community. So I do have to uphold the work that Mary Jo and her team are doing as it relates to health equity. It is important in a BIPOC community that we focus on this. And there's and Dr. Marlon Priest, who is Chief Clinical Officer, is the person who is accountable for that. So I want you to know Cone Health is addressing health equity in our community, as we should be coming out of a pandemic.
Thank you, Mae. Yes. Thank you. Yep. And yes. We have time for one more. That's you. Yeah, of course.
Hi there. I'm Liz. I'm with the Goodsboro JCs, but I'm also in international logistics with Volvo Trucks. So we have in my particular area of work, it's mostly male dominated, right? I work with different international different cultures, things like that. We actually interact a lot between the healthcare and some of the Volvo brands. Our 3D printers made a lot of the masks for the healthcare professionals during the pandemic. We do a lot of, obviously, transportation, Volvo Trucks. And not to add anything on your table, but one of the questions I'm always asked, whether it's at work or, as a volunteer on the board, how can we all work together as, to mentor the next level, the next, generation? Because I'm a mentor at work, I'm a mentor with the JCs, and I see a lot of times we work in silos, even within industries, right? And like you mentioned, a lot of times we haven't gone to the same school. I mean, I'm not even originally from here. I've been here 10 years, but I'm originally from the French Riviera. So, but I have a lot of friends who went to Harvard, that went to MIT. I have a few that are executives at Amazon. And my interns, I get them linked up straight, with them. And it just takes a couple of people to open so many doors, right? But how do we do that here to retain the diverse talent that we have here so eventually we can bridge that gap, with the starting stones of whatever difference we have between our male equal parts, But what is Cone Health doing to maybe work together as synergy with other companies like Volvo Trucks, who's very international? And we do have a lot of women in leadership at that company as well.
I'll start. Silos, I'm allergic to those. I think we all are, right? It's always a challenge to try to break those down. And I'll tell you, where we are today in society, it's going to require all of us, if I'm being quite candid. Everyone, if we all do our part, right, to mentor and bring someone along with you as you're being brought along, I can assure you this world will be a better place. I don't prescribe to it's the CEO's role or the chief people officer or COO. We all own it, right? We all have to do our part from where I sit. And, we're meeting with other healthcare organizations trying to think of ways that we can partner together to bridge gaps that, government aren't able to bridge, right? And there are things called what I call utilities, right? They're basic needs that we need to thrive, and why should we be struggling to bridge those gaps? Let's do it together. So we've got to find ways, and we talked about networking and relationships. We've got to find ways to bring everyone together and connect the dots as much as possible and do our own part. So I think it's a mindset. It's a mindset that we have not arrived, and we all have to do our part and own this body of work for us to move forward.
When I was talking about the importance of partnerships, this is a great example of that. That's why we're supposed to be exchanging our business cards today, right? And so this is a great example of where connecting and having those crucial conversations about what would a partnership for development of talent look like, right? So when I talk about the importance of partnership, this is exactly one of those things that I'm referring to. There are a lot of things that we've not done before that we should be doing. And that's one example, and I bet any one of you could think of a dozen others that we ought to be doing.
Just to help us to wrap up this amazing discussion, I heard the power of partnerships, live in your culture, knowing your superpower, being deliberate in the community and intentional in the change we want to see in the world. And to be authentic to who we are. And I just want to thank you all for your leadership, for all you do for the community, for your support of this event, for allowing us. You're the reason why we all got to be together today, to share our stories, to build our community, and to be even stronger together. So thank you all. Please join me in welcoming and thanking our speakers. Thank you. So just because the panel is over does not mean the party is over. I see more food coming out. The bar has also now been turned over from sodas and waters to something a little stronger. And we encourage you to stay to be together for the afternoon. You also have all on your chairs a special gift from Cone Health, from Sunbrella, and then the business cards on the table from the Windham team. Thank you all so much for coming. We hope you enjoyed your day. Thank you again so much. See you all soon.